Welcome to our exploration into how pandemics reshape human behavior. Today, we dive deep into the psychological and societal changes driven by global health crises like COVID-19. Chapter 1. Behavior under crisis. When a global pandemic sweeps across nations, one might expect to witness widespread panic and disorder. However, the reality of human behavior during crises such as COVID-19 often contradicts these expectations. Instead of chaos, there is a prevalent emergence of resilience and adaptability among the masses. This chapter delves into the psychological and societal changes driven by the COVID-19 pandemic, highlighting the remarkable ways in which humans respond to unprecedented challenges. During the initial outbreak, the instinctive reaction might have been one of fear and confusion. Yet, as the situation unfolded, a significant shift occurred in the collective mindset. People began to adapt quickly to new norms, such as social distancing, mask wearing, and heightened hygiene practices. This adaptation was not driven by fear alone, but by a strong sense of community and shared identity. Across diverse cultures and regions, a common goal emerged: to safeguard the collective well-being. This collective response is a testament to the social dynamics that influence personal behavior during a crisis. Studies have shown that during emergencies, rather than descending into selfish chaos, communities often experience a surge in altruism and cooperative behaviors. Individuals become more likely to follow guidelines that protect not just themselves, but others as well, driven by an innate sense of duty to their fellow humans. This phenomenon, often referred to as disaster collectivism, reveals that social ties and shared identities can become stronger in the face of shared threats. The role of effective communication during a pandemic cannot be overstated. Clear, consistent, and transparent communication from leaders and health authorities plays a crucial role in shaping public response. When people are well-informed and trust the sources of their information, they are more likely to comply with public health directives that might otherwise be seen as onerous. The dissemination of accurate information helps to mitigate rumors and misinformation, which can exacerbate panic and lead to non-compliance with safety measures. The pandemic has highlighted the capacity of communities to innovate and problem-solve in times of crisis. From grassroots movements to manufacture personal protective equipment to neighborhood support groups helping vulnerable individuals, a sense of innovation has thrived. These community responses are not just about addressing immediate needs, but are also a profound expression of human creativity and solidarity. The behavioral response to the COVID-19 pandemic has been complex and multifaceted. While the crisis posed significant psychological stress, it also demonstrated humanity's capacity to adapt and unify under pressure. The resilience shown by communities worldwide underscores the importance of social bonds and the intrinsic human drive to collaborate for the common good. As we continue to face ongoing and future challenges, these lessons in human behavior provide valuable insights into the strengths and vulnerabilities of our societies. Chapter 2. Compliance and conformity. The way people responded to health guidelines during the COVID-19 pandemic provides fascinating insights into human psychology and the impact of governance on behavior. Initially, when governments around the world began issuing health and safety directives, the level of compliance varied significantly. Over time, however, a pattern emerged. National guidelines tended to exert a stronger influence on behavior than state or local advisories. This chapter explores the intricate dynamics between compliance, conformity, and the power of authoritative voices in shaping public behavior during a pandemic. The significance of clear national guidelines cannot be understated. Research has indicated that when such guidelines are coherent and unified, they have a substantial impact on public behavior. For example, following national stay-at-home orders, there was a marked decrease in mobility across different regions, demonstrating a broad compliance with the guidelines. This suggests that people tend to respond more uniformly to directives perceived as being of higher authority or broader relevance. The psychological impact of unity in action, promoted at the national level, can often provide a sense of security and clarity in times of uncertainty. Social conformity also plays a critical role in how these behaviors unfold. Humans are inherently social creatures, and their actions in public or communal settings are heavily influenced by the behaviors observed around them. During the pandemic, this was evident as people adjusted their behaviors in line with what they perceived as social norms. For instance, mask wearing and social distancing became more prevalent as they were more visibly adopted within communities. This form of behavioral conformity is underpinned by what psychologists call normative social influence. The model of social conformity not only helps to explain the initial uptake of preventive measures, but also the persistence of these behaviors over time. As more people adopted masks and social distancing, the actions themselves reinforced the new social norms, creating a feedback loop that maintained and even strengthened these behaviors within communities. Interestingly, even when official guidelines were relaxed, many continued to adhere to the strict behaviors they had adopted, demonstrating the stickiness of social habits once they have been established under collective pressure. Additionally, the role of misinformation and its counteraction through effective communication became critically important. In situations where misinformation was rampant, compliance with health guidelines often wavered. Effective communication by authorities, which involved not only the dissemination of clear guidelines, but also the debunking of myths and misinformation, was crucial in maintaining public compliance. This aspect of pandemic management highlights the necessity for trust between the public and those in power, where trust is built on transparency, consistency, and the visible effectiveness of policy measures. The adherence to pandemic-related health guidelines is a complex interplay of individual psychology, social influence, and governmental communication. Understanding these dynamics is crucial for crafting strategies that not only seek to mitigate the immediate effects of a pandemic. Chapter 3: Economic Shifts and Behavioral Adaptation. The economic landscape dramatically transformed as the COVID-19 pandemic unfolded, exposing and exacerbating underlying disparities in the economy. This chapter examines the K-shaped recovery, where different sectors and populations experienced starkly different economic outcomes. We delve into how these economic shifts influenced human behavior, driving changes in work patterns, consumption habits, and social mobility. As the pandemic forced nations into lockdowns, the immediate impact was a sharp contraction in several industries. Travel and hospitality were among the hardest hit, experiencing unprecedented declines in revenue as international travel halted and social restrictions were imposed. Conversely, industries related to technology and digital services saw a significant surge in demand. This bifurcation in economic fortunes led to what economists describe as a K-shaped recovery, where parts of the economy rebounded swiftly while others lagged or declined further. This divergent economic impact had profound implications for the workforce. Many high-income workers, often in tech-centric roles, transitioned smoothly to remote work, experiencing continued employment growth and even wage increases. In contrast, low-income workers, particularly those in service-based roles, faced job losses, reduced hours, and financial instability. This disparity not only influenced immediate financial security. For many, this meant altering spending habits, relocating to less expensive areas, or changing careers altogether. The economic strain was particularly pronounced among marginalized communities and people of color, who were disproportionately represented in vulnerable sectors. The pandemic not only heightened existing inequalities, but also underscored the systemic barriers that prevent equitable economic recovery. As a result, these groups often face tougher decisions around health and safety, balancing the risk of virus exposure with the necessity of maintaining income. Behavioral adaptations to these economic pressures were varied. Some sought additional education or training opportunities, aiming to pivot to more resilient job sectors. Others embraced entrepreneurial ventures, particularly in digital marketplaces, reflecting a shift towards more self-reliant forms of income. Consumer behavior also transformed significantly. The acceleration of e-commerce adoption and digital payment methods are prime examples of this shift. People not only changed what they bought, but how they bought it, with more seeking out online options for goods and services traditionally purchased in person. The economic downturn influenced social mobility. Economic hardship and the search for better opportunities led to significant migration patterns, both within countries and internationally. Individuals and families moved from high-cost urban areas to suburban or rural locales, driven by the appeal of lower living costs and the feasibility of remote work. This migration has potential long-term effects on urban planning and development, as well as on the demographics of communities and their economic structures. The economic impacts of the COVID-19 pandemic have led to significant behavioral adaptations across various domains of life. The ripple effects of these changes highlight the interconnectedness of economic health, personal behavior, and societal structure. As we continue to navigate the aftermath of the pandemic, the insights gained from these economic shifts will be crucial in shaping policies that aim to foster a more resilient and equitable economic future. Chapter 4: Mental Health and Social Impact. The COVID-19 pandemic has left an indelible mark on global mental health, profoundly affecting how people interact, work, and manage stress. This chapter explores the psychological toll and societal changes triggered by prolonged isolation, uncertainty, and the fear associated with a global health crisis, delving into the lasting impacts on communities and individual behavior. As nations implemented lockdowns and social distancing measures, the immediate necessity to reduce physical interactions led to an unprecedented reliance on digital communication. This shift, while maintaining connections in one form, significantly altered the nature of personal interactions. For many, the lack of physical presence led to feelings of isolation and loneliness, exacerbating mental health challenges. The mental load of living through a pandemic characterized by fear of infection, grief from loss, and the stress of economic uncertainty has resulted in widespread increases in anxiety and depression across diverse populations. Particularly hard hit were specific demographics such as healthcare workers, who faced intense work environments and daily exposure to the virus, and students who had to adapt to remote learning and reduced social interactions. Research highlights a significant rise in post-traumatic stress disorder among medical staff and heightened anxiety and stress disorders among youth, underlining the need for targeted mental health interventions. Moreover, the extended duration of the pandemic has intensified its psychological impacts. Initial coping mechanisms often gave way to longer-term mental health issues. Increases in substance abuse and drug overdoses were reported globally, indicating that many individuals turn to such methods as a form of escapism or self-medication. Alcohol consumption and the incidence of domestic violence also spiked, reflecting the strain of continuous lockdown conditions and the associated social and economic pressures. The pandemic has also had a noticeable impact on crime rates. While some areas saw a reduction in typical crime rates due to lockdowns, others experienced surges in specific types of crime, such as cybercrime and domestic violence. From a societal perspective, the pandemic has challenged existing social structures and necessitated a re-evaluation of community support systems. Social resilience, communities' ability to recover from adverse events, has become a critical focus. With increased attention on strengthening mental health services, the crisis has underscored the importance of accessible mental health resources and the need for robust support networks, both formal and informal. The chapter concludes by considering the future of mental health post-pandemic. It emphasizes the importance of integrating mental health considerations into all aspects of public health and policy planning. Ensuring that mental health support is a staple part of recovery plans is essential for fostering societal resilience and aiding individuals in adjusting to a post-pandemic world. The COVID-19 pandemic has not only transformed the landscape of global mental health, but has also reshaped societal norms and behaviors in profound ways. As the world continues to navigate and recover from its impacts, the insights gained into mental health and societal changes will be crucial in building more supportive and resilient communities. Chapter 5: Looking Forward. Behavioral Insights for Future Pandemics. As the world slowly emerges from the shadows of the COVID-19 pandemic, it becomes imperative to glean lessons from the vast array of behavioral shifts observed during this global crisis. This chapter focuses on consolidating these insights to better prepare for future pandemics, emphasizing the critical role of behavioral science in enhancing public health responses and policymaking. The COVID-19 pandemic has reinforced the significance of understanding human behavior in the context of health emergencies. One of the key lessons is the importance of early and clear communication. The effectiveness of public health measures such as social distancing, mask wearing, and vaccination is heavily dependent on public compliance, which in turn is influenced by how, when, and from whom people receive information. Future pandemic preparedness must involve strategic communication plans that not only deliver clear, concise, and accurate information, but also engage community leaders and influencers to boost public trust and compliance. Another crucial insight is the resilience of community and the power of collective identity in shaping responses to crises. Policies that foster a sense of unity and shared purpose are more likely to see higher compliance rates and less resistance. Moving forward, public health strategies should incorporate mechanisms that strengthen community bonds and emphasize collective over individual well-being. This includes supporting community-led initiatives and using social media platforms to enhance feelings of connectedness and mutual support during times of isolation. Additionally, the pandemic highlighted the disparities in health behaviors and outcomes among different socioeconomic and demographic groups. Future interventions must be tailored to address these disparities, ensuring that all segments of the population have equitable access to resources and information. This might involve multilingual communication strategies, mobile health services in underserved areas, and culturally sensitive health messaging that resonates with diverse communities. The role of technology in shaping health behaviors has also been underscored during the pandemic. Telehealth services, mobile health applications, and digital contact tracing have shown potential in managing disease spread and providing healthcare services remotely. For future pandemics, leveraging technology to enhance healthcare delivery and public health monitoring will be crucial. However, it is also necessary to address the digital divide that prevents certain groups from benefiting from these technologies. The mental health repercussions of the pandemic call for a more integrated approach in future health emergency responses. Mental health considerations should be incorporated into all stages of pandemic planning, from the initial response to long-term recovery efforts. This involves expanding mental health services, integrating psychological support in primary care, and promoting mental health awareness at the community level. In conclusion, the behavioral insights gained from the COVID-19 pandemic provide a blueprint for more effective handling of future health crises. By integrating these lessons into comprehensive public health strategies, we can not only mitigate the impact of future pandemics, but also enhance the overall resilience and well-being of societies worldwide. As we look ahead, the intersection of behavioral science and public health will undoubtedly play a pivotal role in shaping a safer and more prepared world. As we conclude our exploration of pandemic psychology, how disease outbreaks affect human behavior, we reflect on the resilience and adaptability humans have shown. This series has not only illuminated the challenges of pandemics, but also underscored the power of collective resilience and the importance of mental health. We've learned that understanding human behavior and psychological dynamics can equip us to handle future challenges more effectively. As we continue this journey of discovery, we invite you to join us. Subscribe and hit the notification bell to stay updated on our latest explorations into human psychology and societal changes. Thank you for being part of this enlightening experience. Let's keep learning together and see you in the next video.